Greetings, everybody. I'm trying to start the meeting. It's about 8 p.m. for us. First, I will share some information about our program. I suppose it is okay. Yeah, this is the poster of our meeting. We're going to talk on strategies for promoting population mental health and well-being. Our guest is Professor Margaret Berry. To say a few words about her long CV, I will just in brief try to tell you that Dr. Berry holds the established chair in health promotion and public health at the National University of Ireland, Galway, where she is also the director of the World Health Organization Collaborating Center for Health Promotion Research. Having published widely in mental health promotion, she works closely with policymakers and practitioners on the development, implementation, and evaluation of interventions and policies at both national and international level. Professor Berry has extensive experience of coordinating international mental health promotion initiatives and has acted as expert advisor on mental health promotion policy and research development in a number of countries around the world. She has served 2 terms as a member of the European Commission expert panel on effective ways of investing in health from 2013 to 2016, and again 16 to 19. And she was elected in 2019, let me say, as Global President of the International Union for Health Promotion and Education. I think this she will be talking about a bit, and we will have lots of important clues about health promotion from that address. We have 3 discussants among us. One family physician, assistant professor, Dr. Özden Gökdemir, and 2 medical students, one intern Dr. İrem Keçeci, and the other Bihter Ezgi Türkün. I am the moderator. Dr. Özden Gökdemir graduated from Karadeniz Technical University Faculty of Medicine in 2002. She completed her specialization education in 9 Eylül University in Izmir, Faculty of Medicine, Department of Family Medicine in 2016. And she has PhD degree at Department of Physiology in 2016 at the same university. Between 2016 and 2018, she completed her compulsory service in Sparta. She became assistant professor in 2018 at İzmir University of Economics, Faculty of Medicine, and now working as assistant professor at the same university. Bihter Ezgi Türkün is a medical student at Marmara University Faculty of Medicine, taking the elective neurosurgery clerkship program, surgery and psychiatry. PECT student study group, president of Marmara Genetics Neuroscience Medical Technologies in 2020-2021. I keep saying different ways of doing these and the rest. Intern Dr. İrem Keçeci, we in Turkey call the last year medical students intern. It's not the same as in United States, but here we call them intern doctors. Last year medical student at the same university, Marmara University School of Medicine. She is serving as an intern in the Department of Internal Medicine at the moment, currently participating in different research on psychiatry about childhood trauma, procrastination, sexual dysfunction in Behçet's disease. She has always wanted to be a psychiatrist since the beginning of the medical school and has actively participated conferences organized by our organization, Association for Community Mental Health Promotion, and also Psychiatric Association of Turkey, especially in the last 3 years. This is a brief, I don't know how brief it is, a brief note about our discussants and also our guest. Now, welcome, Margaret, once more. Please share your screen and we are ready to listen to you.
Thank you very much. And let me start by saying I'm really pleased to be able to join you for this webinar today, and I look forward to our discussion. So I will now share my slides. Okay. So the topic, as you heard, is strategies for promoting population mental health and well-being. So in the talk, I'm going to look at a population health approach to promoting mental health and well-being and unpack a little, what does that mean? What does it look like? And I think it will provide perhaps a different way of looking at the challenge of improving mental health and well-being if we look at this from a population level. So I'm going to cover some of the evidence around what works in promoting population mental health, what that looks like in practice, and some examples of interventions across the life course and that can be implemented in everyday settings like the home, the school, the community. So I think when we look at progress in terms of promoting population mental health, we can see that there have been significant advances. Certainly in the last century, we saw a major shift in terms from hospital-based to community-based services. We've seen that happening globally, and also a shift to embrace a biopsychosocial model with big improvements in terms of treatment and in terms of recovery approaches. And this century, we're also now seeing a shift towards a focus on prevention and mental health promotion, and seeing that the promotion of mental health is coming on to the global health and policy agenda. So I think it's we're seeing progress, but there are still quite a number of significant challenges remaining. I think when we look at population health, more broadly, mental health remains on the margins. The focus is still very much on physical health. Likewise, mental health policies and services are still poorly developed in many countries. And I would say that probably in the majority of countries around the world, there's a lack of focus and investment in mental health promotion and prevention. So there's still quite a lot to do to advance that agenda. However, I think we can see that there's increasing recognition, particularly in recent years, that in promoting and improving mental health is really integral to improving health and well-being more generally, that we cannot really talk about good health without including good mental health, and that is important both at an individual level, but also at a societal level. Because if we want to enable people to lead healthy and fulfilling lives, to build up their resilience and reduce their risk of poor mental health, it's really important that we promote and protect good mental health. We can also see from data available on the growing burden of mental ill health globally. And we can see that mental disorders are a leading cause of disease burden worldwide. And we can also see that there are significant major inequities in the distribution of poor mental health. And we can see that, poverty is a big driver of poor mental health, as is, low levels of education, poor housing, poor living conditions, the experience of social exclusion, etc. A lot of these social factors contribute. So if we want to address this growing burden and those inequities, we need to take quite a comprehensive approach. And this is very much what has been advocated by the World Health Organization. And they have advocated a public health approach to mental health. And we first saw that coming through in 2001, 2002, and then a number of reports in 2004 and in the most recent policy documents. I think what was pointed out in terms of these documents was that we need the best treatment approaches, this is for sure, and there are still a lot of treatment gaps in many countries. But the treatment approaches on their own will not be enough to improve population mental health. And actually, this is what has happened in most areas of health. If we look at cardiovascular diseases, if we look at cancers, if we look at diabetes, we need good treatments, but we also need to look at how we can reduce the risk and prevent those problems, and how we can promote good health, like good heart health, healthy lifestyles, healthy environments. So mental health, if you like, is probably coming to this a bit later than some of the other areas in health. But WHO have strongly endorsed this and saying we need to embrace promotion and prevention alongside treatment and recovery. So we need to focus on all these areas. This is very much what's reflected in the current Global Mental Health Action Plan. This was initially published by WHO in 2013, and we've seen the continuation of that now from 2021 to 2030 in the Comprehensive Mental Health Action Plan. And it really talks about the essential role of mental health in achieving health for all. And it's again endorses the need for comprehensive strategies for promotion, prevention, treatment, and recovery, and that this needs to embrace a whole of government approach. It's not just for the Department of Health, it's not just for the mental health services, it's got to go broader. And we need to protect and promote the mental well-being of all citizens, because we all have mental health needs. So it's really highlighting that universal need, and that the responsibility for this extends across a whole of society. We need a lot of different actors, different government departments involved if we're really going to make these substantive changes that are needed. So it's really talking about mainstreaming mental health as part of public health, as part of our wider social economic policies that are needed. And we can see that this emphasis is now being reflected in regional policy frameworks and in national policy frameworks. I think another major focus we can see is that within the UN Sustainable Development Goals, mental health is referenced explicitly, I think, for the first time on the Global Development Agenda. As part of Goal 3, to ensure healthy lives and promote well-being for all at all ages, we can see in the target 3.4 that it references reducing mortality from non-communicable diseases through prevention and treatment, and is explicitly promoting mental health and well-being. So it's recognizing that mental health is really important to ensure healthy lives. And I think it also recognizes that the UN, many of the goals outside of Goal 3 are really also important in contributing to good mental health, like no poverty, quality education, gender equality, sustainable and healthy cities and communities. All of this is important for population mental health, and good mental health contributes to these other areas. And I think also for anybody who wasn't convinced, I think the impact of the pandemic and COVID-19 has really, I think, highlighted for people how important mental health is at a population level. People's mental health was really kind of challenged during the periods of lockdown, social restrictions. And we've seen, the importance of that being sort of increased in public discourse, and people are much more aware of the fact that we all have mental health needs, and there's a need to protect and promote good mental health for all. And this was again in the UN UNICEF's World Youth Report in this year, well, actually last year, excuse me, we're in February 2022. Time has kind of gone very strange over the last while. But in last year's report, the Youth Mental Health and Wellbeing again put a big emphasis on mental health promotion for children and young people and how important that was. Okay. So, sorry, it's just skipping slides here. Okay, there it is. So we talk then, I just want to talk a bit about adopting a health promotion approach to mental health and what that means and what it looks like, because that's what I'm talking to you about, I suppose, in this webinar. I suppose the first thing is that when we talk about a health promotion approach, it puts the focus on the health end of the continuum rather than illness end. So it embraces a positive concept of mental health, that mental health is positive. We all have mental health needs, so it's universally relevant. It also focuses on the social determinants of mental health. You know, alongside the others, we have the biological, the psychological, but the social determinants, I guess, are quite modifiable. So psychosocial determinants that we can modify. And that requires, you know, a cross-sectoral approach to look at what are the conditions that are needed to support good mental health. And so in many respects, when we take this health promotion approach, it brings a change in thinking about mental health. So we shift from seeing, you know, a focus on mental ill health or a deficit model of illness to now look at mental health as a positive resource. How do we kind of promote that and create the greatest mental health gain for the greatest number of people? So that's the population level approach. And so we need to look then at the potential of people in the context of their everyday lives to promote, enhance, and protect their mental health. So in that sense, it reframes our challenge of improving population mental health. Sorry, for some reason, yeah, this keeps skipping. Okay, so we can see, I mean, we're fortunate, I think, that in the last 20 years, we have seen much more of a focus on how concepts of mental health are understood from a positive perspective. And if we look at the WHO definition, it defines mental health positively as a state of emotional and social well-being. It's an aspect of well-being in which the individual realizes his or her own abilities, can manage the normal stresses of life that we all experience, can work effectively, and is able to play a role in one's community. So it's the stuff of everyday life, really. And there has been a lot of work done around understanding the positive mental health from a conceptual and a research point of view. And I've highlighted just some here, the work of Corey Keyes, from a sociological perspective, Felicia Huppert from the science of well-being perspective, and Carl Riff and colleagues from a positive psychology perspective. So looking at mental health as a sense of subjective well-being and life satisfaction, and also a sense of positive functioning, engagement, and social well-being. So those kind of two dimensions are really important, the subjective well-being, but also the positive functioning and social well-being. And Corey Keyes, his dual continua of mental health, I suppose, looks at the fact that people who are deemed mentally healthy can often experience periods of poor mental health. And likewise, people who are diagnosed with mental illness can also experience good periods of mental health. So it isn't a kind of mental health here and mental health, ill health over there. So it's not a kind of either bipolar, you know, either or. And he talks very much about the concept of, you know, that there are a lot of people functioning with moderate mental health, but experience quite a lot of problems that go unnoticed and not dealt with. And so that, and he also put forward the idea of flourishing, which is when you experience really high levels of mental health. And of course, they have looked at data from the US, epidemiological data from surveys of adults, looking at the distribution distribution of the different types of mental health and mental ill health. So it's really talking about the ability to develop holistically, psychologically, physically, emotionally, intellectually, socially, and spiritually. And that's being part of this conceptualization of positive mental health. Sorry, it's happening again. I beg your pardon. We've also seen, I suppose, a greater understanding of the social determinants of mental health. And I often reference this short report from the WHO and the Kaluska-Gulbenkian Foundation. And one of the key messages coming out of this was that mental health and many common mental disorders are shaped to a great extent by the social, economic, and physical environments in which people live. And I think often we tend to think of mental health as being an individualized, phenomenon, psychological, physical factors. But in fact, these external social factors are also really important. And this report called for actions to improve the conditions of daily life, because these are really key influencers of mental health. And of course, if we want to do that, if we want to improve housing, employment opportunities, education opportunities, recreation, quality of life, we need a whole of government and a whole of society approach, because those sectors have a part to play. And that requires comprehensive and universal actions across the life course, and at all these multiple levels. So really it's advocating what we call an upstream approach. So it's moving from the individual level to an upstream approach where policymaking at all different levels of governance and across sectors can make a positive difference to mental health outcomes. And it's really calling for that. So in terms then of, addressing the social determinants of mental health, the models of mental health promotion call for this multi-sectoral, actions at different levels, at strengthening the individual in terms of cognitive, social, and emotional skills, life skills, coping, social relationships, strengthening communities, where there's a sense of social inclusion, connectedness to others, support, participation, and engagement. Reorienting health services so that we have a focus on promotion and prevention alongside treatment and rehabilitation. And then at the macro level, removing those structural barriers to mental health at a societal level, be that in terms of culture, environment, economic and social policies. And this is sometimes referred to as a mental health in all policies approach. And this requires calls for access to resources and opportunities to be available, be that supportive relationships or education, employment, and good housing. And that is really intersectoral policy initiatives, because if we want good housing, it's not going to come from the Department of Health. And if we want good education, it's going to come from the Education Department. So the need for that is quite important. So here at this point, I just want to make a distinction, I guess, between promotion and prevention. And while the two areas do overlap, they do start in slightly different places. So mental health promotion, the focus, as I said, is on positive mental health across populations and across the life course. And it's about building psychosocial strengths and competency, skills, and resources. So the emphasis is on enhancing those skills, enhancing those resources. With prevention, we're concerned with preventing mental disorders, mental health problems. And so here the concern is reducing the incidence, prevalence, or seriousness of problems like anxiety, depression, and suicide. And the goal becomes reducing mortality, morbidity, and risk behaviors. So they are starting in slightly different places and looking for slightly different outcomes. So this graph here was produced by Mrazek and Haggerty in Institute of Medicine report in the US in 1994. You might be familiar with it, but it looks at the mental health intervention spectrum and looks at where prevention sits alongside treatment and rehabilitation. And you can see treatment there, case identification. But prevention is divided into three kind of subsections. So you've got universal prevention, that's of relevance for everybody. So we all need to improve our coping skills, okay, our social and emotional skills. We have selective prevention, that would be for groups that are at higher risk by virtue of their life experiences or by their living situation or experiencing disadvantage or trauma. And then we have indicated prevention, where there's already early signs and symptoms of problems that need attention. So this was the Mrazek and Haggerty framework for prevention. And then in 2001, I kind of decided to extend that to say we also need to include mental health promotion, because that's the piece, if you like, that's under the waterline as well, where we need to look at empowering people around their mental health, improving competence, resilience, but very importantly, supportive environments. And you can see that universal prevention and mental health promotion are quite close, but also recovery and rehabilitation is also quite close, because people don't stay in any one of these. They may move between these various sections. So another way of illustrating this that I find particularly useful is this illustration here, which came from Australia, again in the late 1990s, looking at building capacity to promote mental health at a population level. And it looks at, how the different areas target different populations. So populations with mental disorder, obviously the focus there is on treatment and recovery and optimal management. Then we have populations with symptoms, and here obviously early diagnosis and intervention. And this may sometimes happen in terms of general practice, primary care, people present. So it's important that there is a correct diagnosis and intervention as early as possible. But then we move to populations that may be at risk because they're exposed to certain environments or exposed to certain experiences. So reducing that avoidable risk. And here, this is prevention. Prevention of disorders and mental health problems. And then we come to the so-called healthy population, who are not presenting as being particularly we're all at risk, but they're not presenting as being particularly at risk or with symptoms. And the challenge then is, how do we build resilience, maintain supportive environments, and promote good health for the population? So that's mental health promotion. So I think it's a good way of seeing how promotion, prevention, treatment, and recovery work together, and the range of approaches that are needed. So when we talk then about adopting a mental health promotion approach, in our publication, Implementing Mental Health Promotion, which was edited by with Alicia Clark, Inga Peterson, and Rachel Jenkins, who's on the line, and I can see Rachel here. In this text, we define mental health promotion as being concerned with strengthening protective factors for good mental health and enabling access to skills, resources, and supportive environments that will enhance equity and keep individuals and populations mentally healthy. So that's the definition there of mental health promotion. The principles underpinning mental health promotion are, as we identify the whole population as the target group rather than individual patients as such. It's population-wide. The focus is on protective factors for enhancing mental health and well-being. And we look to address the broad determinants of mental health, including the social, physical, socioeconomic, and cultural environments and factors that influence that. So we need quite a range of complementary approaches and integrated strategies at different levels, both at the level of the individual, but also at the social and environmental level. And this means intersectoral action, extending quite a good bit beyond the mental health services. Now, over the last 30 years, we've seen quite a good advancement in building up evidence around the promotion of mental health and the impact that it can have. And I can say that we now have fairly compelling evidence that when we promote mental health, that it leads to benefits for the improved health and well-being of individuals, their families, and society as a whole. It enhances protective factors for good mental health. It reduces the risk for disorders, but it also has positive impact on a range of broader outcomes, be they like children doing better in school, people doing better in terms of their social functioning and their physical health, and also, you know, doing better in terms of engagement with employment and economic outcomes. So there are a lot of broad range of benefits. So we have a convincing social and economic case for investing in the promotion of mental health and well-being. So we have a number of evidence-based strategies that have been identified that can be implemented and sustained at a reasonable cost while generating clear health and social gains. And that's important. Usually these take a life course approach, you know, that they're starting from infancy and going right through up to older age. They're delivered in the everyday settings where people live their lives, in homes, schools, communities, workplaces. And it takes a determinants of mental health approach so we can work to reduce inequities in mental health. So the focus, I suppose, on many reviews and evidence synthesis that have been done, and we've worked on quite a number of these for WHO and different governmental agencies, is to look, are there cost-effective approaches that are also feasible and that are kind of culturally acceptable that can be delivered within existing systems. So in my next slide, I'm going to sort of just integrate some of the findings from some of these evidence synthesis that we have worked on for the WHO European region, for the Eastern Mediterranean region, some work with Inga Peterson that we did in terms for the World Bank in terms of their mental, neurological and substance use disorders publication, and work that Rachel and I did with Alicia and Vikram Patel for the WHO on looking specifically at low and middle income countries. So this is a busy slide, but it's trying to show the level. This is Inga Peterson and I put this together for the that publication with the World Bank, but it's looking at different platforms through which interventions can be implemented, and then reviewing the evidence in terms of, do we have good evidence, and do we have it from high income countries, and also do we have it from low and middle income countries, so that it can be implemented across different resource contexts. So starting at the top, at a population level, I mean, in terms of regulation and legislation, we can see there that, for example, laws and regulation to reduce demand for alcohol use and laws to restrict means of self-harm and suicide, there's quite good evidence supporting that now across a range of high and low and middle income countries. There's also good evidence to support the integration of mental health into legislation and regulations regarding occupational health and safety. And so looking at the workplace, so that when we talk about health and safety, we're not just thinking about being exposed to toxic substances, but also discrimination, harassment in the workplace, those kind of psychosocial risks, if you like, that are there. And so health and safety regs now include mental health within them. So again, this can be quite effective. At a population level, there are also a number of awareness campaigns to improve people's literacy regarding mental health and to reduce stigma. And again, there's evidence from mainly coming from high income countries regarding the impact and less so from the low and middle income countries. Then when we move into the community setting, and I've broken this up into different, we look first at workplaces, and there's quite a focus now on integrating mental health and promoting the well-being of employees in the workplace. And the evidence is building up here, both in terms of individual interventions, but also organizational interventions, how work is organized, how people are how that work is structured, and the culture of management, etc., and how that influences employees' mental health and well-being, as well as also attending to problems in mental health early on in the workplace. In schools, we now have quite strong evidence regarding the impact of programs which teach social and emotional skills in schools, adopting a whole school approach. So building it into the mission of the school, building into the curriculum, but also into the policies that are there within education, and including targeted interventions for those students who are more vulnerable and at higher risk, prevention of anxiety and depression. So there's quite good evidence regarding that. So at the community level then, we have good evidence also for preschool education, for out-of-school programs, and also for programs around economic empowerment, like microfinance for families living in poverty. So we have promising evidence around the impact of that for health, for mental health and economic well-being, mainly from low and middle income countries. Also quite good evidence regarding parenting and family strengthening programs for school-aged children going up into adolescence. Quite strong evidence from high-income countries and promising from low and middle income. And then coming into primary health care, again, we have very, very compelling evidence regarding the importance of the early years and the making sure that promoting mental health is integrated within routine antenatal and postnatal care, and also home visiting and parenting programs. In relation to then for adults, we, again, training primary healthcare providers in mental health promotion so that it becomes part of the routine consultation. So mental health is inquired about. So the focus isn't always on physical symptoms. And again, here there is emerging evidence regarding the impact of that. So this is kind of an overview. Yes? Dr.
Berry, excuse me. Would you allow me to ask one thing at this moment?
Yes.
As you very well know, most of the criticism about mental health promotion is related with those studies being carried on in high-income countries. But here we see that you have a lot of evidence from low and middle income countries. Could you elaborate that a bit more? Which low and middle income countries, especially, because this is a very crucial point, I believe.
Okay.
Thank you, and sorry for interrupting.
No, that's great. No, I am going to talk, I was going to skip through quickly, but I'm going to talk about a few examples, and maybe there I can highlight where the evidence, the countries the evidence is coming from. So these are just, I was focusing here on young people. So let me just go on. So if we look at the early years, here we have a lot of evidence around the positive impact of incorporating a focus on social and emotional development, both of the child and the mother, into prenatal and postnatal care services. Very much a strengths-based approach, both universal and targeted, and particularly for women and children that are higher risk, be that teenage parents, mothers with postnatal depression, or mothers exposed to intimate partner violence. And in fact, the evidence here, like we have very long-term positive outcomes from early years interventions. That first one there, Young et al. 2021, that's a global review. There are hundreds of studies included in this meta-analysis, so it's a global review. And we can see here that there are studies from a range of countries globally around in this particular area. From Jamaica, from Africa, from Asia, I mean, across the board. So actually, there is saying that if we have this focus on kind of promoting the positive mental health, incorporating that into the early childhood development, that it benefits the child, it benefits the parents. Mostly they have focused on the mothers. It reduces problems, and that it makes good economic sense. From the US, they have done cost-benefit analysis and showing that for every dollar invested, there's a $23 return, because you're reducing the need for further services down the line. And the good thing is that those who are most at risk make the most gains. So it's quite convincing from that point of view. So examples here, the nurse-family partnership, this is mainly from high-income countries developed in the US, but implemented quite widely, and Sure Start from the UK. But if we look at like the Falani Mothers, that's a program from South Africa, and Community Mothers, which is actually an Irish program that has been implemented in a number of countries, and that's delivered by trained community workers. So it's mothers who are trained to provide support to other mothers, so it can be implemented in low resource settings. And so it's about integrating this focus into mainstream services. So really making sure that it's scaled up so that the focus on social and emotional development of the child and the mother. And there's a lot of emphasis now as well on the impact in relation to postpartum depression for women who are at increased risk, that the prenatal interventions can actually be quite successful. And of course, here we're saying support should be proportionate to need. Okay, for some families will need more in comparison to others. For the preschool, there is also quite strong evidence now that if we have good quality preschool programs that incorporate a focus on the child's social and emotional well-being, as well as their cognitive development, that this leads to very strong outcomes. And again, it's a good economic investment because there's a very good return on these programs, and particularly for those children who are at higher risk and disadvantaged. Now, there is more evidence in this area coming from high-income countries, but there are examples of programs from low-income countries that have also shown good effect. And I suppose the issue here is that the programs may be in place, but often there isn't the funding to do the research around the evaluation. So that's often the issue, that there's a lack of investment in the research. But we're seeing that the evidence coming through from low and middle income countries is increasing around this. So again, supportive policy around preschool, mainstreaming the focus on children's social and emotional development into these structured preschool programs. The same is true in terms of strengthening families. And again, there are some very strong programs with good evidence, particularly around children experiencing behavioral problems and conduct disorders. So again, having early intervention here seems to be quite important, and equipping parents with the skills to develop positive relationships and to manage those behavioral problems. And again, good benefit to cost ratio and benefits for the children, the young people and their parents. So again, the Strengthening Families Programme, the Triple P programme from Australia, but has been implemented quite widely. CHAMP is a program there, which again is from low-income countries. Lifelong parenting has been implemented across a number of low and middle-income countries. So they're coming, there's quite a range of different programs with different approaches. Some are behavioral, some are cognitive behavioral, some have more kind of communication elements. But the evidence is very strong in relation to these. And they have a wide range of application. You can see their incredible years. Some have a focus on school, others deal with children with autism or on this autistic spectrum, school readiness or universal or targeted. So there's quite a range of offerings, including online offerings, which makes it more affordable as well. Okay, let me go back. So in terms of schools, this is another area where there's the evidence again is very strong here around school as being a setting where we can really promote young people's mental health through improving their social and emotional skills, building up their resilience, and making sure that we do that it's on a whole school basis. So incorporate it into the curriculum, but also make sure that it's there across the curriculum. So we don't teach about anti-bullying in a 25-minute class, but then allow bullying in the playground. So we've got an engaging, parents and the wider community. The evidence is very robust around long-term positive outcomes when children are taught social and emotional learning. And these are universal programs for all children, for all young people. And very important from the point of view of teachers and educators is that it leads to improvement, not only in terms of their mental health. We can see reduced conduct problems, reduced emotional stress and depression problems, but also it improves their performance in school. Children can learn more effectively, they're more present, they're more engaged, they're more positive for school because school is a more positive experience. And we can also see that we have both universal and targeted programs. The targeted programs work better for those children who have higher levels of depression and anxiety. So again, for those more targeted approaches are better. And again, delivering these programs within the school context makes good economic sense. There are benefits to education as well as to health sector. Okay, so examples here, Kids Matter and Mind Matter. These are two examples from Australia that have been implemented at a whole country level. So there was federal investment around for primary school and secondary school children. The anti-bullying whole school approach is a Finnish program, Kiva, which is also part of it is available online as well as, and it looks at bystander intervention for bullying. Very good outcomes from that. Then we have curriculum-based programs like the Friends program looks at prevention of anxiety. And then we have digital interventions largely based on CBT approaches like Mood Gym and gaming programs like Sparks. So these are more targeted prevention programs. So what we can see is that, you know, when we deliver these school-based programs, they're more likely to work if they're embedded into educational policy, if they're within the core business of the school and teachers are trained and supported to deliver these. So it isn't like an add-on, it becomes a core part of the curriculum. Now, within my own country, in Ireland, we have a well-being curriculum. So the focus is on that's the overriding focus within the current educational policy. So these social and emotional learning programs sit very well within that and having resources to deliver it. So we've been working in developing this program called Mind Out, which is a social and emotional learning program for the senior cycle and adolescence, and which can be implemented by teachers. We've done big randomized controlled trials on that to look at its effectiveness and also the importance of the quality of implementation for good outcomes. So I don't want to go on too long, but when we look outside of the school setting, you know, for those young people where school isn't their preferred setting or they opt out of school, the out of school community setting is also important. And these social and emotional skills can be taught through other means, like through creative arts, being involved in drama and music and sports and outdoor adventures. So there's a range of other ways of developing these skills including, you know, social action projects, mentoring for young people, particularly those young people who are at risk. And in low and middle income countries, we've seen a lot of these programs have a focus on life skills, but also gender equity and reducing exposure to violence and poverty. So they have multi-components actually built into them. Now, the evidence from these programs is not as strong as it is from the schools programs, but that's largely because the research on the schools programs is highly structured. They do RCTs and they make their way into the evidence reviews. But when we look at the community-based interventions, the research that's done is less likely to have a control group and etc. So the designs are different. So we need to look at how we can more comprehensively evaluate these programs in a way that's meaningful, but that can show their benefits. So like Big Brothers, Big Sisters, mentoring, youth development programs that have kind of outdoor elements to them and communities that care. And then just quickly then, before I conclude, the other area, obviously for young people, are digital online technologies. The virtual setting is, and we all know it's become so important for us all now, the virtual setting. So a lot of hitherto programs for all ages have become virtual. But there is very strong evidence for computerized CBT prevention programs, for example. The evidence around the mental health promotion programs is emerging rather than being established. We can see online, like gaming programs that are being used to develop emotional regulation skills, mobile phone interventions, blogging, online support. We did a systematic review back in 2014, and there is more evidence coming through now around these. But I think it's really important that we look at how digital interventions can be used to improve mental health literacy. And obviously for people who are working with young people, we need to look at how we can improve their digital literacy in order to use these programs effectively. Okay, so let me start to kind of wrap up. So what we can see is that we have evidence that mental health promotion interventions, that they do lead to a broad range of health, education, socioeconomic and development outcomes. And that the reviews to date support the use of both comprehensive strategies, employing universal, so that's for all, for everybody, as well as some targeted interventions for people at higher risk. We need interventions that create supportive environments in family, in school, community, workplace, health services, and in virtual settings. And obviously, these interventions need to cater for mental health needs at the population level. So it needs to cater to the needs of very diverse groups. And we need more evidence around the needs of particular groups. So, be that in terms of socially marginalized groups, minority groups, we need more evidence in relation to those areas. So there is potential for scaling these up, using the best evidence to guide practice, making sure that what's implemented is culturally appropriate and that it's feasible in the local context, and to make sure that it reduces inequity rather than increases it, so that it reaches, as I said, many of those groups who are at higher risk by virtue of their experience of poverty or social exclusion or marginalization. So it's really important that when we put these evidence-based interventions into practice, that there's good guidance around making sure that the implementation is of really good quality, because if it's not, we won't get the good outcomes. So at a broader level, I think putting mental health promotion into practice, we need supportive policy. So the policy needs to give a mandate for this, and it needs to mandate the engagement with other sectors. So again, in my own country, in Ireland, we're embarking on developing a national mental health promotion framework and plan. And this has been led by the Department of Health and by our health service executive. So they're and that gives the mandate to engage across government departments in order to make this possible. We need to make sure that we have the structures and the capacity in place at a practice level to deliver on this, so that we have people on the ground who can make this happen, who can support the implementation of the interventions, particularly in low resource settings, so we can maximize reach and impact. And then ensuring, as we've mentioned during the presentation, that there is the research to support good implementation, and that there's the research to support scaling up. So that means really that we have to invest in mainstreaming mental health promotion policies and practices, and mobilize, I suppose, a wider public engagement around this, so that there is really a demand for this to be put in place. And I think we have a good opportunity now with mental health needs being highlighted so much during the pandemic to really follow through on that and deliver on it. So that, I think, brings me, where is my slide? It's gone. Brings me, yes, to my, yes, sorry, I just put some references there for you that you can have a look at as you're interested. And then that brings me to my final slide, is that we need to make sure that we have the conditions that can create and promote mental health, and make sure that it's accessible to all, that it's for all, not just for a few or for some. So I'm going to leave you there. That picture is from my village where I live, where I'm talking to you from now. And you can see a nice double rainbow there out over the bay. So thank you very much for your attention.
Well, We thank you a lot, indeed, especially the place you are talking from is excellent. I hope you were there as well.
Yes, this is the local village actually, which is about 2 miles from where I am now.
Great, great. And we have Rachel Jenkins among us. It has been a bit surprise, but a very good surprise. I'm sure she will also contribute. After, with her permission, I would like to ask first to our discussants what their contributions will be. Then we will turn back to Rachel Jenkins. Is there anybody who wants to speak first? When it is open to all, it's hard to, yeah, Özlem, please.
Thank you very much. It was very enthusiastic to listen to you, because there's a writer there and there's an author there that we can just speak with you. It is great. My question is, what do you think about the mental stigmatization? Even in the healthcare workers, we can see that. How can we overcome when we are talking about health promotion?
Yeah, I think that's a really important question, not only for the area of services, but for generally when you're trying to promote mental health. There still is a kind of something of a stigma where people say, well, I don't have mental health problems, so why should this be of interest to me? And I know when we started working with schools quite early on, they say there isn't a mental health problem in the school, you know. So there is, and getting across the fact that mental health is a positive concept. when we talk about mental health, it just doesn't mean illness and problems, but that mental health is positive, but also that everybody experiences problems, and that we do have improved treatments as well. So I think the destigmatization of mental health at a population level is a very important part of this agenda, you know, because we all know how important mental health is, but if it doesn't find its way into the public discourse, and if there isn't an opportunity to bring that forward and talk about it, I think then, you know, you're going to get blocking, and you get it at every level in the services. Amongst politicians are not going to pay attention to this if they feel that it's, you know, it's a stigmatized area. It's not going to be a priority for the people that they represent. But I do think that during the pandemic, I do think that some of that stigma was challenged quite a lot, you know, and I do think that there is a kind of an opening there to say, look, you know, mental health is really incredibly important, and to make sure that people are knowledgeable about how they can promote and protect their own mental health as well. So that public awareness agenda is really vital.
Thank you very much. If I have got permission, I have got second question. If not, I will just get my turn.
If you don't mind, let's go and finish the first two, then come back to you again. Huh?
Thank you very much.
All right, thanks for the question and for the answer. Irem, would you like to say a few words?
Okay, first of all, thank you for your enlightening speech. It was very good.
Could you, we can't hear you well.
Okay. Now, can you hear me?
A bit.
How about this? Is it better?
I think it's better.
Okay. So first of all, thank you for your enlightening speech. I want to ask something about medical students. Have you ever worked on medical students as a population, as a part of population? Because according to researchers, we know that psychiatric problems like anxiety or depression are more common in medical students than the other university students. For promoting mental health in family medicine or in primary care, I think that we must ensure that our medical students, then our medical graduates, how can I say, our medical graduates are ready for this promotion, because even they have their own mental problems. I think it will be difficult for them to help the others. So what do you think about medical students and mental health promotion in medical students?
Okay, no, thank you for that question. I think it's an important one. I haven't worked with medical students in terms of interventions, but we do teach health promotion on the medical undergraduate program and on some of the postgraduate programs as well. And I think your point is really important, because this comes up also in relation to working with schools and teachers, and having exposure and training in this at a pre-service level, so that people are equipped to deal with this, that they're knowledgeable about it themselves. But then your point is also, I think, an extra point around self-care and self-awareness in relation to mental health. And I think unless at an individual level, health professionals have that, they're not going to be able to extend that to others and to the people they're working with. So I think it's really, really important at two levels. First, that there is kind of knowledge at a kind of curricular level about this. And secondly, that there is knowledge at the level of self-care and self-awareness for health professionals around protecting and promoting mental health. Now, I am aware of there are a number of kind of interventions being rolled out in the third level sector, university sector, around healthy campuses and around mental health promotion for students more generally. And we can see from all of the research and all of those surveys that were done over the last 2 years during the pandemic, that students' mental health has been severely impacted, due to kind of all lectures being cancelled and all the social restrictions has really impacted on that age group. And so that there is a focus more generically around mental health promotion in the university sector, for students. I haven't seen a particular focus around medical students or health professionals in relation to that, but I think that would be, and I think you'd need to approach it differently probably for that group, actually, given their professional training, do you know what I mean, and the professional role that they will have. So I think that's quite an important area, actually. Yeah, I mean, I wonder, to what extent do you think that students would be open to this?
Thank you. So, I'm not sure. As I see around myself in my university, there are lots of students who need help in terms of mental health, but they even don't know where to apply or who to talk with. So I think that it's important for them to give them a resource about that.
Yeah. And I think this is where some initial online resources can be quite helpful in terms of pointing people in the right direction or finding a space that you can anonymously engage with in order to open up the discussion. If that's done well, it can actually be a kind of stepping stone to other things, Yeah.
Thanks a lot for the question and the answer. And now, Bihter, it's your turn. What are you going to say or ask?
Before getting started, I want to thank you for your inspiring presentation. Before you started, when I see the subject, I really get interested because it's very important for everyone, of course, but especially for us, for medical professionals, because like you said, doctors are dealing with pathologies, but not just pathologies. We are also trying to prevent them. And what you're saying, like promotion and preventing this, these are really important for us. And I like to keep that focus on mental health rather than the mental illness. I really like this sentence a lot. And I want to mention the second line, like who definition of health is physical and mental well-being together. I think the society, I think they know this, but I don't know, maybe they don't care, or maybe they can't think of this. The physical health is for them, or for us, everyone. There is no one to accuse. For everyone, physical health is always more important than mental health. So my first question is from here, how we can, or what can we do about this?
Okay. Yeah, I mean, I have focused quite a bit in my work around schools and young people, because I think this is absolutely critical. If in school, you know, we learn the skills about identifying emotions, managing emotions, knowing yourself, knowing your strengths, you know, these which all of us need. But so if we learn that, and we learn more about our own mental health and well-being and how we can protect that, I think people are going to be much, and I can see that in young people, they want to talk about this. This is not something that they see as distant. It's really very close to their hearts, and they don't have an issue. So I see a big change actually from my generation to the next generations, where they see that this is as part of their identity, as you know, as adolescents growing up, you know, their mental health and well-being is very close to the surface, you know, and important. So I think that that's really important, that we start as early as possible and put an emphasis on this. I think actually naming it, being explicit, and this is where the language is difficult, because, you know, a lot of people don't want to talk about mental health because they assume this is actually talking about mental difficulties, problems, you know, that think it's negative and don't want to go there. So I think there is the how we communicate about this, how we speak about it. And a lot of people will say, well, that's just for professionals, you know, as an ordinary person, I don't know about this. So I think it's about kind of rowing back a little bit on that and looking at the fact that we all are experts insight in terms of what works for me, you know, and empowering people around that. I think at the social level, media as well, in terms of how various topics are reported and dealt with, like suicide, and having some kind of, you know, I know, for example, in Australia that they had programs working with journalists around how they report and deal with mental health issues. And that's really important, because that can actually change the discourse at a public level around this. But yeah, I mean, you're right. I mean, while we're happy to talk about our physical ailments and symptoms, we are less willing, perhaps going back to the Usman's original comment about the stigma. People are probably don't want to go there as readily. And so I think we've got to work at this at multiple levels, and also at a kind of policy level as well, to kind of put an importance on this. And really say, you know, this matters, we're investing in this, because there's a lot of lip service being paid. But then when you look at budgets within health services, you know, the budgets for mental health is quite small. And then within the mental health budget, the fraction that is given to prevention and promotion is minuscule. You know, so I mean, if if we want to invest in what matters, there's quite a lot of advocacy needed around this, so at all of those different levels.
Thank you so much.
Thanks a lot. For our first tour, may I ask Rachel if she has anything to contribute, to say, to add?
Thank you very much, Bulent, and thank you, Margaret. I thought it was a great talk. There's nothing I want to disagree with, but I made a few points, if that's all right, to sort of amplify. So you'll just have to stop me, Bulent, if I go on too long. I wanted to pick up the financing point, because I've done quite a bit of work, I suppose, over the last 20 years, working with ministries of health in low and middle income countries, supporting them develop their mental health policies, amongst other things. And I never found any difficulty getting mental health promotion and prevention written into the policy. That was fine. It was also fine to get the intersectoral approach written in. And when meeting the other ministries, they would always see the point, the rationale, and why it mattered, and see the need for it. But the problems came when you need a kind of hub of enthused human resource to drive it nationally, regionally, at district level and at local level. And that's the challenge, because in low and middle income countries, by definition, there is no money, as it were. The studies usually come from funded, finite research programs of 3 or 4 years or so, and that's it. But in terms of national rollout, I've kind of learned in a way the hard way. The only way to think of implementing something is to take your existing resource, whatever people you've got whose salaries are already paid, and work with them through training programs to get them to incorporate mental health promotion and prevention into their daily working lives. So that means trying to start the basic curriculum, you know, with you as medical students, nurse training, teacher training, and so on. And then in whatever CPD programs you can get yourself into, to teach it then as well, so that every public sector worker feels that whatever level they sit at, whether they eventually sit at a national level, a regional, a district level, or a local level, they will see mental health promotion and prevention as part of their role and understand how it integrates and do it. So for me, that's the most practical way of moving forwards. But I don't think it at the moment, we can't just sit there and wait for some brilliant donor to come along and give us billions, because it's not going to happen. So that was the one thing about how we solve the financing problem. And I think it does need a hub of enthusiasm at the central level, so that you're constantly in dialogue with the prisons, the schools, the police, etc., so that they're working on this. One of you raised the issue of stigma, and it's absolutely true. But I think my answer to that, and also always with my colleagues, was it's like a drip effect. You've just got to keep on having the discussions, having the dialogue. And years ago, in the 90s, when I was in my own Ministry of Health, and I used to go to the annual meetings of employers, the Confederation of British Industry, to persuade them to include mental health in their policies. And the first time we were talking about this, these employers looked at me as if I'd handed them an agar plate full of the HIV virus. You know, they just looked at me appalled. You know, how could I possibly suggest mental health might be an issue? But in successive years, they were all very interested. They would drop by and describe how they'd been horribly stressed and how it was really important. And so you just have to keep the dialogue going. And I think for most people, they know somebody in the family who's been depressed or anxious or psychotic, you know, and have had to deal with it. So you don't have to keep the conversation going very long before they really start to understand the issues. But I think we mustn't be afraid of saying the same thing over and over again and to keep going. So that was that. I think primary care is really important on a personal, individual level, because they're in pole position really to push promotion and prevention at a life course level. In every consultation, they can think not just about the detection and treatment of whatever the presenting illnesses, but think about the wider context and what promoting intervention would make a difference, you know, whether it's diet, exercise, social networks, and so on. I wanted to raise the issue about prevention and risk factors, our biggest risk factor in the UK by a long, long way is childhood sexual abuse and then bullying. It's a 20 times risk factor. Whereas if you're thinking about poor housing, divorce, unemployment, it's like a 2 times risk factor. Personal unmanageable debt is 6 times the risk. All right. So I think we know quite a bit about the serious risk factors it's crucial to have public policy on. As well as clinicians being alert to helping somebody on an individual basis. So I've talked about the integration with training. I think if I did have lots of money, I'd focus on Margaret's whole school approach. You know, I think that's the whole school approach to build resilience in our children is crucial. The other thing I'd add here is years ago.
May I ask to have that last point in the second tour?
In the second tour, we have the first one. I would like to go to Özden. Oh, I beg your pardon.
If you don't mind, because you told me to stop you, huh? I'm relying on your sincere understanding. Okay?
You were going to somebody else. What?
Yeah, if you don't mind.
Not at all, not at all.
Thank you. But we'll come back to you. Özden, you had another question to ask.
I will combine with Rachel's last words, so there won't be any problem with that, I guess. Because my question was about mental health workers. Today, now another risk factor in my country, in Turkey, is being physician. If you're a family physician, your risk factor is just getting a little bit over because you're overloaded and because your salary is low, and also you can be just get fight with or you can't be hit by a patient or the patient's relative because there are violence in everywhere at your workplace. And the other uncommon thing is about mobbing. It was interesting that when we look at the PubMed or the other literacy, we can see the nurses and what midwives and mobbing, but we don't see anything about the assistants or trainees or physicians. That is there any mobbing or not? It is just some kind that we are not looking at it, so that means we don't see it. When Bihter just said that it is okay not to be okay, yes, there is mobbing and we can just say it. But maybe we don't just doing it. And that's why in the reports and in the publications, we don't see anything. That means there isn't. But the truth is not there. It is just the elephant in the room. And because this reason, maybe we do need structural environment for mental health promotion for the physicians too. And if it is something sustainable and available, maybe we can just overcome the stigma too, because it will be just for everybody. If it is something for everybody, like our nose, goes, eyes, hair, so that won't be anything to do that because this promotion is for all of us. And do you think that kind of future could be available? What do you think about it?
Excuse me, before going to the answer, could I ask Irem and Bihter if they have anything as the second question? Because, you know, we have limited time. Irem, would you like to ask or make any comment on the things people have talked on?
Not about the things that recently talked, but it's about something that's written on the slides. I have a small question. So you have mentioned about ensuring healthy lives and promote well-being for all and for all ages. So it makes me think that nowadays I'm an intern doctor at the internal medicine ward, and we have lots of elderly patients over there. And sometimes we make consultations of psychiatry if they enter a state like delirium or something like that. But normally we don't do anything about their mental health, but they stay 1 month or 2 months in the hospital, in the intensive care units, and their mental health gradually going bad more. So what can we do for them? Because we know that elderly are more vulnerable for physical problems, but they are also more vulnerable to psychological problems, I think. So what can be done for them?
Thank you a lot. Margaret, if you don't mind, may we also ask Bihter? Mm-hmm. Bihter, what would you like to say? Thank you, İrem.
My second question is about the infant period. We said that it should be normalized to have a mental breakdown or to be sad or cry like this. But when we were kids, or at least when I was a kid, my mom, my father, my brother, like anyone around me told me that be happy, smile, like that. So when I was a kid, I just thought that my happiness or smiling or positive things is the goals of my life. When I realized that they weren't, I feel kind of relieved though. So I am asking this for families or families have new babies or having to expect one. What will you suggest them? Or what would you like to say to them to not be like anyone around me?
Yeah, so may we hear now Margaret Berry?
Yeah, I'll just do a quick response to each of the questions if I can. I won't be able to answer them comprehensively, but just do a quick response and then maybe we can go on to Rachel if she wants to add something as well. Austin's point about physicians, I think actually having workplace mental health promotion interventions, having mental health as part of health and safety in the workplace, I think is really important because it's going to bring in all of the workers. And like if we've got high levels of stress amongst nurses, amongst physicians, among assistants, it's going to impact on the whole team, obviously. And there are examples of interventions that have been put in place. For example, you might be familiar with the Schwartz rounds, which is about self-compassion for people working within the hospital sector, where when people experience trauma in the course of their work, or maybe made a mistake and don't feel they can talk to anybody about it and are really worried and concerned, and so there's quite a lot that can be done there. But also, it's also about how the workforce is organized. I mean, having long hours, long schedules that are inhuman. Nobody could be expected to thrive under those conditions. So those kind of organizational level interventions are really important, as well as the individual resilience, because there's some conditions that we shouldn't get used to. Basically, it's not a good idea to constantly adjust to highly demanding situations. So sometimes we have to change the situation. To İrem's point about older people, the evidence base is not, there's much less evidence regarding mental health promotion for older people. And you're quite right that it's often ignored, actually. And I've been reviewing this recently, and a lot of the emphasis is on physical exercise. There's some around mindfulness now, but it's quite limited. I mean, when you look at older people, the age span, it's huge. They talk about older people being over 60. So people are living, there's a whole 30 years there. And so healthy aging, positive healthy aging, needs to include positive mental health. And when people are in the hospital environment, there is an opportunity for promotion and prevention in that window as well. And there's also interventions regarding prevention of dementia and other approaches, but we need to expand the range of those. It's quite limited at the moment. And then finally, coming to Bihter's point about in the early years and expectations around what good mental health. I mean, good mental health isn't being happy all the time. So you're absolutely right. I mean, good mental health is about having the skills to survive pain and disappointment and cope with sadness, because that's as much a part of life as being happy and enjoying life, because we need to experience both sides of it. And so it's about, I think, that kind of, what is going to be realistic and developing the skills to manage that. And I think that that's in there, because, it's not just about happiness, even though we all strive for that, but also understand we can't be ecstatic all the time, and actually it's more basic than that. And so again, those social and emotional learning programs kind of operate around that, problem solving, coping skills, etc. Okay, so I'll stop at that point. That's a quick response.
Thank you very much. Yeah, now please, Rachel, sorry for interrupting.
That's all right. I can talk forever. Picking up the last point first about the elderly, I think I'd be a bit more positive about this than Margaret, maybe. I think from the epidemiological data we've got, I would be quite gung-ho with the elderly, really. I think they need to do their 10,000 steps a day, good diet. They need their social networks. We need to make sure they're not deaf, because that's really bad for mental health. They often have multiple physical conditions which need treating and properly sorting out, particularly pain, which is really bad for mood and so on. So I think GPs could be much more assertive about managing the elderly and really pushing things like exercise make a huge difference actually to well-being, I think, and just how long you're going to live, and live a healthy life as opposed to a disabled life. So I would push that a bit more, I think, maybe, but maybe that's coming from a sort of more medical point of view. I think the thing about doctors, there were some studies of medical students and nurses, I think in the early 90s, which I drew on quite a lot then, but I don't know that many people have done it since. So again, when I was in the UK ministry, I set up a general practice fellow to work with GPs across the country to boost their mental health, to really help the profession as a whole think of ways to support their own mental health. And we did the same thing with occupational doctors. So these were time-limited posts for about 3 years, which is all I could raise the money for. But it was really to try and raise the profile of these issues across the profession and get them to get themselves together to work out what they were going to do. And I think it is a very important problem, because when you track the UK workforce, we are losing doctors at a young age. There's a massive retention problem where people are leaving much too soon in every age cohort. So they clearly are stressed, burnt out for whatever reason, and going off to do something else. So I think it's still a critical problem that needs addressing. I was going to say, if I might, about depressed mothers, depressed parents, but particularly depressed mothers, have a very deleterious effect on their children's growth, development, emotional development, cognitive and physical development. Indeed, children with depressed mothers have a higher mortality, particularly in low and middle income countries. And there was once a child psychiatrist at the Institute of Psychiatry, Dr. Chani Kumar, who's dead now, but he said to me, Rachel, the most important preventive thing you can do is treat depression in mothers. So I just throw that out, that we don't want mothers to be depressed because of the damage to children. And of course, Michael Rutter did his work on the cycles of disadvantage, that if parents are depressed, the children grow up depressed, and then they have depressed children and so on. So you have to break into that cycle and stop it for healthy kids. I've mentioned the importance of a whole school approach. I have taught it to working with the Federal Ministry of Education in Pakistan and the Ministry of Education in Kuwait. We've taught it to teachers there, and they loved it. even though their school environments are obviously much, much more challenging than we have here, particularly in Pakistan, often 100 to a class and so on. But nonetheless, they found it really helpful and transformative. So I do think that's a good initiative to keep your eye on. I wanted to, somebody, yes, talked about persuading people, one of you, I think it was Bichter, about the importance of persuading people about how crucial mental health is. And I know there was a study where they asked people, including students, what they would prefer to have, whether they prefer to have a physical illness or a mental illness. If you were told you had to have one illness, what would it be? Nobody chooses the mental illness. They would all far rather have a physical illness. So I think it shows that everybody deep down understands that it's not nice to have a mental illness. So deep down, people know how important it is to do something about it, but we have to keep the dialogue going. And the other thing that I wanted to bring up is the concept of mental capital, which is a concept that has never flown, but it was explored in depth by a UK kind of scientific review called the Foresight Programme of Mental Capital and Wellbeing in 2008. And the idea is that in the same way you want to build up your human capital and your financial capital, we want to build up the capital of the brain, if you like, the mental capital. In a way, it's what parents seek to do for their children and what teachers seek to do. So you're trying to develop cognitive, emotional potential, nurture well-being, but it's like the resource that you will carry through your adult life with you to help you deal with all the knocks and blows that everybody has to face. So in a way, it's resilience and empowerment stuck together, I suppose. But I think it is an interesting concept, and I find it quite helpful to use in discussions with ministries of health too. You know, they're thinking about their financial capital. Let's think about the mental capital of the country and how important that is for development. So I think that's probably it. Thank you, Bülent. Thank you. Thank you, Margaret.
Thank you. And we have almost come to the end. Just before closing, first let me ask our discussants, do you have anything to add or to ask very briefly? We have little time, and the last words will be Dr. Barry's.
Well, thank you very much for this opportunity to talk with these enthusiastic authors and clinicians. And also, maybe we can get a link about the things that Professor Dr. Rashad said about Pakistan, that maybe we can just do something about it to get collaboration. And also with Margaret, Professor Dr. Margaret, maybe again, new collaborations can be done. Thank you very much.
Okay, thanks. İrem, Bihter. Thank you.
Thank you for this opportunity.
All right.
It was a very enlightening speech. Thank you.
Thanks. Please, Dr. Barry, let's close with your remarks.
It just remains for me to thank you all very much for listening and for engaging in the discussion today. I really enjoyed it. And I think mental health promotion is a very positive area. I think there's much work to be done, but there's much to be achieved. The rewards are great, I think, if we can get this right and do it well. And I think we can only progress. So if I've persuaded you to sort of embrace this and become involved, then great. So thank you very much.
I'm sure there will be many other interested and impressed people who will be watching this later. Thank you all for your being with us. Bye for this evening, or bye for this meeting. Thank you.
Thank you very much, everybody. Thank you, Margaret.
Nice to